Traumatic head injuries are a serious public health concern, affecting millions of people worldwide each year. These injuries can have a devastating impact on individuals, families, and communities. Understanding traumatic head injuries is crucial for prevention, timely diagnosis, and effective treatment. A traumatic head injury, also known as a TBI, occurs when an external force, such as a blow or jolt to the head, disrupts the normal function of the brain. These injuries can range from mild concussions to severe, life-threatening conditions. The consequences of a TBI can be far-reaching, affecting physical, cognitive, and emotional well-being. It is essential to recognize the signs and symptoms of head injuries and seek immediate medical attention if a TBI is suspected. By understanding the causes, symptoms, and prevention strategies for traumatic head injuries, we can work together to reduce their incidence and mitigate their impact. Imagine the brain as a delicate organ floating inside the protective shell of the skull. During a traumatic head injury, the brain can be jolted or hit against the skull's hard interior. This impact can cause bruising, bleeding, and tearing of brain tissue and nerve fibers. Think of it like a fruit inside a hard container. If the container is shaken violently, the fruit can be bruised, even if the container remains intact. Similarly, a blow to the head can injure the brain even without a skull fracture. The force of the impact can cause the brain to swell, leading to increased pressure inside the skull. This pressure can further damage brain cells and impair brain function. In severe cases, the brain may even herniate, pushing through openings in the skull, which can be life-threatening. Understanding the mechanics of a traumatic head injury is crucial for appreciating the potential severity of these injuries and the importance of prompt medical intervention. Traumatic head injuries are classified into different types based on the severity of the injury. It is important to note that even seemingly mild head injuries can have long-term consequences if not properly managed. A concussion, for instance, is a mild traumatic brain injury that results from a blow to the head. Concussions are often caused by falls, sports injuries, or car accidents. Symptoms of a concussion may include headache, dizziness, confusion, and memory problems. A contusion, on the other hand, is a bruise on the brain tissue, similar to a bruise on the skin. Contusions can occur with or without a skull fracture, and may cause more severe symptoms, such as prolonged loss of consciousness or neurological deficits. Another type of TBI is a diffuse axonal injury, which occurs when the brain rapidly shifts inside the skull, stretching and tearing nerve fibers. These injuries can be severe and lead to long-term disabilities. Section 4. Diagnosis and treatment, a path to recovery. Diagnosing and treating traumatic head injuries requires a comprehensive approach that involves a thorough medical history, physical examination, and specialized tests. Doctors will assess the patient's level of consciousness, cognitive function, and neurological status to determine the severity of the injury. Imaging tests such as CT scans and MRI scans may be used to visualize the brain and identify any bleeding, swelling, or structural damage. Treatment for a TBI varies depending on the type and severity of the injury. Mild concussions may only require rest and observation, while more severe injuries may necessitate hospitalization, surgery, or rehabilitation. Recovery from a TBI can be a gradual process, and patients may require ongoing support and therapy to regain lost function and adapt to any lasting effects. Physical therapy can help improve mobility and coordination, while speech and language therapy can address communication difficulties. Section 5. Preventing head injuries, safety first. Preventing traumatic head injuries is crucial for protecting individuals from the potentially devastating consequences of these injuries. By adopting simple safety measures, we can significantly reduce the risk of TBIs. Wearing helmets while engaging in activities that pose a risk of head injury is paramount. This includes cycling, skateboarding, skiing, and playing contact sports. Helmets act as a protective barrier, absorbing the impact of a blow and reducing the force transmitted to the head. Seatbelts are equally important in preventing head injuries during motor vehicle accidents. When worn correctly, seatbelts prevent passengers from being ejected from the vehicle and reduce the severity of impact in a collision. Creating safe environments at home and in the workplace is also essential. This includes installing safety gates to prevent falls, securing rugs and carpets to prevent tripping, and ensuring adequate lighting to improve visibility. By prioritizing safety and taking proactive measures to prevent head injuries, we can create a safer environment for ourselves and our loved ones. Remember, prevention is always better than cure when it comes to traumatic head injuries.